Eastern medicine diagnosis. How to read face, tongue. Did you know your body is always speaking to you, even without words? In traditional Eastern medicine, simple daily signs like your face, tongue, urine, and even stool hold incredible clues about your health. These are natural diagnostic tools you carry with you every day, helping reveal imbalances long before serious problems appear. In this video, we'll explore these 4 fascinating methods step by step, so you can tune into your body's signals, understand what they mean, and take simple, proactive steps to stay balanced and well. Think of it as learning a new language, the language of your own health. As Hippocrates, the father of medicine, once said, "The natural healing force within each of us is the greatest force in getting well." When you learn to listen, your body becomes its own best guide, diagnosing illness by observing the face. Eastern medicine insights. You know how people sometimes say it's written all over your face? Well, in traditional Eastern medicine, that's actually kind of true. Your face is like a map of what's happening inside your body. Different areas. Your eyes, nose, lips, ears, even your eyebrows are connected to different organs. So, if you know what to look for, you can catch early signs of imbalance before they turn into something bigger. For example, your lips can reflect the state of your stomach. Your eyes can show how your liver's doing, and changes in your skin tone might point to circulation or digestive issues. Practical takeaway. Next time you're brushing your teeth or checking the mirror, take a mindful moment to notice your face. Are your eyes dull or vibrant? Are your lips dry or healthy looking? These little clues can help you stay more in tune with your body. Hair-related signs. What your hair says about your health. In Eastern medicine, your hair isn't just about beauty. It's like a window into your blood, hormones, and even organ strength. Here are a few clues. Hair loss can signal your blood or hormones are out of balance, draining your body's natural energy. Gray hair at the temples often reflects too much heat in the liver, a sign your liver might be under stress. Gray at the back of the head connects to the kidneys, showing they may not be as strong as they should be. Gray in the forehead area can point to a sluggish spleen, meaning digestion and nutrient absorption are weaker. Salt and pepper gray spread early is often tied to long-term worry and emotional stress, which slowly chip away at vitality. Practical tip. Notice when your hair changes suddenly, like graying fast or shedding more than usual. Instead of just reaching for dyes or shampoos, ask yourself, am I stressed, sleeping well, eating enough nutrient-rich foods? Supporting your inner balance often shows up in healthier, stronger hair. Ear-related signs. What your ears reveal about kidney health. In Eastern medicine, the ears are closely linked to the kidneys. They're almost like a health mirror for this vital organ. Strong kidneys usually mean sharp, sensitive hearing because chi, energy, and blood flow are nourishing the ears. Weak kidneys, on the other hand, can cause hearing to fade over time. Other signs of kidney weakness might show up as lower back pain, constant fatigue, frequent nighttime urination, dizziness, or that ringing sound in the ears, tinnitus. Practical tip. If you notice your hearing isn't as clear as before or you often get ringing in the ears, it might be time to care for your kidneys. Try getting enough rest, avoid overwork, and include kidney-friendly foods like black beans, walnuts, or sesame seeds in your diet. Even simple habits like keeping your lower back warm can help protect kidney energy. Eye-related signs. What your eyes reveal about liver health. In traditional Eastern medicine, the eyes are directly connected to the liver, often called the window of the liver. When your liver is strong, vision is clear and focused, but when it's out of balance, the eyes quickly show it. Weak liver, blurry or dim vision. Hot liver, red, swollen, irritated, or painful eyes. Cold liver, excessive tearing and watery eyes. Dry liver, blood deficiency. Dry, gritty, or uncomfortable eyes. A practical tip. If your eyes often feel strained, dry, or red, it's worth paying attention to your liver. Rest your eyes regularly, especially from screens. Get quality sleep between 11 p.m. to 3 a.m. when the liver recharges. And add cooling, liver-friendly foods like cucumber, chrysanthemum tea, and leafy greens to your diet. Gentle practices like eye massage or palming can also help soothe and refresh the eyes. Tongue-related signs. What your tongue says about the heart. In Eastern medicine, the tongue is seen as a mirror of the heart's condition, both its physical strength and emotional balance. A quick look at your tongue can reveal a lot. Healthy heart. The tongue looks moist and naturally pink. Excess heat in the heart, mouth ulcers or sores appear on the tongue. Stagnant heart blood, dark spots, rashes, or little purple marks show up. Deficient heart yin. The tongue turns dark red or purplish. Deficient heart yang. The tongue appears glossy, pale, and overly wet. Practical tip. Keep your heart and tongue healthy by balancing both rest and activity. Avoid too much caffeine, alcohol, or spicy foods that can fuel heart fire. Gentle breathing exercises, meditation, or simply taking a walk outdoors can help calm emotions, boost circulation, and support a healthier heart. And yes, a healthier tongue too. Lip-related signs. What your lips say about digestive health. In traditional Eastern medicine, the lips are closely tied to the spleen, an organ that represents your digestive strength and how well your body transforms food into energy. Simply looking at your lips can offer clues about your inner balance. Healthy spleen. Lips look rosy, plump, and naturally hydrated. Weak spleen. Lips turn pale, dry, or even crack easily. Hot spleen. Lips swell or develop sores at the corners of the mouth. Imbalanced diet. Both overeating and undereating can upset the spleen, leading to poor digestion and low energy. Practical tip. Care for your spleen by eating warm, cooked meals instead of too many cold or raw foods, which can weaken digestion. Stick to regular meal times, chew slowly, and avoid eating late at night. Your lips and your whole digestive system will thank you. Nose-related signs. What your nose reveals about lung health. In Eastern medicine, the nose is seen as a mirror of the lungs. When your lungs are in balance, breathing feels smooth and effortless. But when the lungs are stressed, your nose will often be the first to show it. Clear, runny nose with congestion, usually from wind cold invading the body like catching a chill from drafts or cold weather. Hot lungs make the nose look red and swollen. Nosebleeds, often tied to excess heat in the blood or yin deficiency, meaning the body lacks the cooling, nourishing fluids to stay balanced. Practical tip. Support your lungs by keeping your chest and neck warm in cold or windy weather, drinking soothing herbal teas like chrysanthemum or mulberry leaf, and avoiding overly dry environments. Gentle breathing exercises can also strengthen lung qi and keep your airways clear. Eyebrow-related signs. What your brows say about lung energy. In Eastern medicine, the eyebrows are closely linked to the strength of your lung qi, the vital energy that powers your breath and protects your body. Eyebrow hair loss often signals weak lung qi, which can mean lowered respiratory energy and a weakened immune defense. These observations aren't meant to replace medical advice, but they are valuable early signals from your body. Practical tip. To support lung chi, try daily breathing exercises. Eat light and nourishing foods like pears, white radish, or almonds, and avoid smoking or polluted air as much as possible. A calm mind also strengthens lung energy, so gentle practices like meditation or a daily walk can make a real difference. 2. Diagnosing illness by observing the tongue. A practical guide from Eastern medicine. In traditional Eastern medicine, the tongue is like a daily dashboard for your inner world. A quick, non-invasive mirror that reflects the balance of yin and yang, the flow of chi energy, and the quality of your blood. Building on facial reading, practitioners use the tongue to spot patterns early, often before obvious symptoms appear. That makes it a powerful tool for awareness, not a substitute for professional care, but a helpful way to tune into your body. How to check. Do this first thing in the morning before brushing or drinking. Stand in front of a mirror, relax your jaw, stick your tongue out naturally, no forced movements, and note these basic things. Color, coating, the coating or fur on the tongue, shape, moisture level, and any cracks or spots. What to look for. Overview. Color, pale, possible chi or blood deficiency. Red, internal heat. Purple, dark, blood stagnation. Coating, thick, greasy coating, dampness or digestive stagnation. Thin or peeled coat, deficiency or overheating. Shape and size. Swollen tongue, dampness or chi stagnation, thin shrunken, dehydration or deficiency. Moisture. Too dry, yin deficiency, too wet/runny, damp, cold. Cracks, spots. Cracks can point to chronic imbalance. Purple spots suggest circulation issues. Practical tip. Keep a simple photo log. Snap a phone photo each morning for a week or two. Patterns, not single days, are what count. If you consistently notice worrying signs, dramatic color change, heavy coating, sudden swelling, check in with a qualified Eastern medicine practitioner or your doctor for follow-up. Best time and method for tongue observation. When to check. First thing in the morning before brushing your teeth or drinking anything. Natural light is ideal. It helps reveal the subtle colors and details of your tongue. How to do it. Stand in front of a mirror, relax your jaw, and gently stick out your tongue. Keep it natural, no forced movements. Why it works. Your tongue acts like a detailed map of your internal systems. By observing its color, coating, shape, and moisture, you can notice signs of heat, cold, deficiencies, or blockages. Over time, these observations can give you early clues about imbalances, helping you make small lifestyle or dietary adjustments before issues become more serious. Tongue coating, moss or fur. Insights into your health. White, thick, greasy coating. Signals dampness and phlegm accumulation, often linked to rich or heavy foods, poor digestion, or humid environments. Yellow coating. Points to wind heat invasion. Think early stages of a cold, flu, or feverish conditions. Gray-black coating. Indicates extreme internal heat, sometimes called fire, or may result from chronic stress, late nights, or overwork. Other tongue features, shapes, marks, and movements. Teeth marks on the edges. Indicates spleen deficiency or weak chi, often tied to digestion issues or fatigue. Cracks on the tongue. Points to deficiencies in essence, jing, and blood. Your vital reserves may be running low. Smooth, shiny tongue, no coating. Suggests fluid deficiency, meaning your body's nourishing liquids are depleted. Many red dots or spots. signals internal heat or inflammation from overexertion. Deviated, crooked tongue, a cautionary sign for stroke risk linked to wind or blood flow issues affecting the brain. Difficulty moving the tongue can indicate compromised vital chi, possibly from severe illness or extreme fatigue. Small and thin tongue reflects both chi and blood deficiencies, leading to overall weakness. Blue veins under the tongue suggests blood stagnation combined with anemia, pointing to poor circulation and nutrient shortages. These features provide a fascinating window into your health, helping you spot imbalances early. If you notice unusual signs, reflect on your diet, stress, and sleep habits. Small steps like herbal teas, rest, or gentle lifestyle changes can support your body. Still, always consult a doctor or qualified Eastern medicine practitioner for a complete assessment. Diagnosing illness by observing urine. Insights from traditional Eastern medicine. In traditional Eastern medicine, your urine is like a subtle messenger from your body, offering clues about internal balance, energy flow, and organ health. By noticing its color, clarity, and frequency, you can get early signals of heat, cold, or functional issues in organs like the kidneys, bladder, or liver. It's not a replacement for medical tests, but it's a simple, non-invasive way to stay in tune with your body. Let's break it down step by step so you can understand what different urine signs might be telling you and what practical tweaks could help keep things in balance. The basics of observing urine. Why urine matters. Your urine is like a mirror for your body's inner state. It reflects fluid balance, heat, and organ function, especially the kidneys, bladder, and liver. For the clearest view, check it first thing in the morning under natural light and notice its color, clarity, and smell. General rule. Healthy urine is pale yellow and clear, showing proper hydration and balanced organ function. Changes in color, cloudiness, or unusual odor may hint at imbalances. But remember, things like diet, medications, or exercise can also influence what you see. Urine color, what different shades might tell you. Very clear or colorless urine. You might be overhydrated or carrying excess cold in your body, which can leave you feeling chilly or sluggish in digestion. Pale yellow urine. A good sign, your body's in balance and no major concerns here. Honey-colored dark yellow urine indicates dehydration or internal heat. Your system may be running hot and dry, needing more hydration or cooling foods. Orange-yellow urine could point to liver or gallbladder stress where bile flow or detox pathways are affected. Brown urine, a red flag for liver issues. Serious buildup or damage might be happening, so don't ignore it. Pink or red urine signals potential kidney problems, possibly blood in the urine. Seek medical advice promptly. Red, milky white, or greenish urine, often linked to urinary tract infections or inflammation. A professional testing is important here to address the cause safely. Other urine characteristics and peeing patterns. Extra clues from Eastern medicine. Oily or foamy urine, a sign of chyluria, where lymph fluid leaks into urine, sometimes caused by parasites, blockages, or excess fat. Painful or dribbling urination indicates damp heat in the lower body, often linked to infections or inflammation affecting the bladder or kidneys. Frequent urination after drinking lots of fluids could point to Zio-Ki wasting thirst syndrome, a concept similar to early signs of diabetes. If persistent, it requires medical attention. Difficulty urinating or retention. suggests weak chi or blockages which can lead to further complications if not addressed. Incomplete emptying or accidents reflects poor kidney chi, meaning your energy reserves are low and bladder control is affected. Practical tip: keep a daily log of your urine color, clarity, and frequency. Small patterns often reveal larger trends in hydration, diet, and organ balance. Combine this self-observation with routine checkups and mindful lifestyle adjustments for the best results. Final advice: keep a watchful eye. Ongoing monitoring. Your urine can reveal subtle shifts in health that aren't obvious otherwise. Pay attention to changes in color, clarity, frequency, or discomfort over time. It's a simple way to stay tuned into your body. When to act. If unusual patterns persist or worsen, consult a qualified Eastern medicine practitioner or doctor. These signs are gentle prompts from your body, encouraging you to restore balance through diet, herbs, or lifestyle adjustments. These observations are a fascinating part of Eastern diagnostics, helping you catch potential issues early. Combine awareness with professional guidance to maintain smooth body function and overall vitality. Final advice: keep a watchful eye. Ongoing monitoring. Your urine can reveal subtle shifts in health that aren't obvious otherwise. Pay attention to changes in color, clarity, frequency, or discomfort over time. It's a simple way to stay tuned into your body. When to act. If unusual patterns persist or worsen, consult a qualified Eastern medicine practitioner or doctor. These signs are gentle prompts from your body, encouraging you to restore balance through diet, herbs, or lifestyle adjustments. These observations are a fascinating part of Eastern diagnostics, helping you catch potential issues early. Combine awareness with professional guidance to maintain smooth body function and overall vitality. Diagnosing illness by observing stool. Clear, practical insights from Eastern medicine. Hey, let's get real for a minute. Your stool is one of the clearest, no-fuss signals your body gives you. In traditional Eastern medicine, clinicians have long read stool as a direct message from the gut and connected organs, because what goes in must come out. A daily glance at color, shape, smell, and frequency can reveal early signs of imbalance in the spleen, kidneys, intestines, and more. This is a simple, everyday check, not a medical diagnosis. If you notice persistent or alarming changes, see a doctor. In the sections that follow, we'll break this down step by step: color, form, smell, timing, and give practical tips you can use right away to tune into your health. Quick practical tip: keep a short log or take a quick photo for your own tracking, not sharing when you notice unusual changes. Patterns matter more than single days. The basics of observing stool. Why it matters. Your stool is like a daily health report card. It shows how well your digestion, nutrient absorption, and organ systems are working. When elimination is smooth and consistent, it's a sign your internal balance is on track. How to check. After each bowel movement, take a quick look. Check the color, shape, consistency, smell, and frequency. Think of it as a quick scan, not a deep inspection. Most importantly, pay attention to sudden or persistent changes. Those are red flags worth noting rather than brushing off. Practical tip: if you're unsure whether something is normal, track your stool for a week. Patterns over time give much clearer insight than one-off observations. Signs of normal, healthy stool. Golden yellow, smooth, and uniform. This is the gold standard of digestive health. When your stool is soft but well-formed, passes easily without pain, and bowel movements happen regularly, around once a day, it signals that your spleen, stomach, and intestines are working in harmony. Balanced digestion. It means food is being properly broken down, nutrients are absorbed well, and waste is moving out smoothly. Practical tip. If you're hitting this ideal stool most days, keep supporting your body with balanced meals, enough water, and regular movement. Prevention is about maintaining good habits, not just fixing problems. Abnormal stool colors, potential warning signs. Black stool could mean bleeding in the upper digestive tract like stomach ulcers. This is not something to ignore. Seek medical attention right away. White or pale stool, often linked to bile flow problems such as gallstones, liver inflammation, cirrhosis, or even liver tumors. It's a red flag for liver and gallbladder health. Red stool mixed with blood suggests bleeding in the lower intestines, sometimes from hemorrhoids, but it could also mean polyps or colon cancer. Always get it checked. Yellow, floating stool may point to fat not being absorbed properly, often seen in chronic pancreatitis or bile duct blockages. Green stool with strong odor, typically a sign of gut infection or rapid food transit through the intestines. Practical tip. If abnormal colors persist for more than a couple of days, or if you notice blood, don't wait. See a doctor promptly. Eastern medicine also reminds us that balanced digestion starts with mindful eating. Avoid excess greasy, spicy foods, and eat at regular times to keep your spleen and stomach strong. Other stool patterns and symptoms. Clues to deeper issues. Undigested food in stool suggests weakness in the spleen, stomach, or kidneys due to internal cold, making digestion sluggish and incomplete. Urgent morning bowel movements every day may indicate kidney yang deficiency, meaning your body's energy reserves are too low to properly warm and regulate the bowels. Need to go right after eating. Could be a sign of colitis or inflammation in the large intestine, where the gut reacts too quickly to food intake. Continuous diarrhea with vomiting. This cholera-like condition often comes from severe food poisoning or infection. Seek urgent medical care. Foamy yellow stool with sour odor points to excess heat and toxin buildup inside the body, overwhelming the digestive system. Mucousy stool, a strong warning sign, can be linked to advanced colitis or even rectal cancer. Never ignore this. Get a professional check immediately. Practical tip. Pay attention not only to stool color, but also texture, frequency, and timing. If changes are sudden or persistent, don't self-medicate. Combine Eastern wisdom, like eating warm, easily digestible foods, avoiding excess cold, raw meals with modern medical consultation for the best outcome. Final advice: take action for your health. Check yourself today. Take a few minutes to observe your body right now. Small signals from your face, tongue, urine, or stool are your body's way of waving a flag to get your attention. When to worry. If you notice persistent changes, don't ignore them. That's the time to combine both worlds, modern medical check-ups with Eastern insights for the most complete picture. Stay proactive. These observations are not a replacement for medical diagnosis, but they are a simple way to stay tuned into your health. If something resonates with you, consider consulting an Eastern medicine practitioner or start small with herbal teas, dietary adjustments, and better rest to restore balance. Remember, good health doesn't come from one magic tip. It comes from consistent awareness and daily self-care. And that's it, my friends. We've just walked through 4 simple yet powerful ways traditional Eastern medicine helps us decode the body's signals. By observing the face, the tongue, the urine, and the stool, None of these practices are about fear, they're about awareness. They're reminders that your body is wise, always whispering hints about what it needs, whether it's rest, balance, or a little more care. So take a moment each day to tune in. Notice the small changes. Respect them. Act gently and consistently, and you'll find that prevention truly is the best medicine. As the great physician Sun Simiao once wrote, the superior doctor prevents sickness. The inferior doctor treats sickness. Let us all strive to be the superior doctors of our own lives, walking with awareness, balance, and compassion toward ourselves. If this video inspired you, don't forget to share it, because health is never a solo journey. Together, we can build a community of awareness and wellness.